Time to stop living with nagging pain and stiffness that affects your everyday life. If managing pain feels like a losing battle, this program is just for you. I'm Kevin Fong, and I'm so excited to guide you on your road to a pain-free life. Now, let me give you a little skinny before we go. The great news about this is, despite how complicated a medical diagnosis you may have, it's pretty simple to heal your back. It's all about habitual change. And that kind of links into, unfortunately, the bad news, which is habitual change is a pain in the butt to fix. So it's gonna take a lot of practice, but work with me and let's start solving it. It's never too early to start activating your core. That's in theory what's gonna stabilize your back from moving too much, which is often why you're feeling back pain in the first place. A brief anatomy lesson. When we think about core, sure, it's the front, it's also the back. Let's focus on the front for now. I'm not referring to the sexy washboard abs along the beach. I'm honestly referring to something low. We call it your transverse abdominis. They are deep abdominal muscles that fall in a transverse pattern, and they actually connect to your back, almost similar to like a corset or a belt. So you can really think about the more you strengthen that, you can stabilize and secure your back, and that's really the underlying way we're gonna address back pain, okay? So identify it by poking into your belly button with your middle fingers, bringing your hands out and bringing your hands slightly down 2 inches, and voila, you found your transverse abdominis. Sitting on your heels, shake your back out, give it a second to rest. Let's roll together in a sitting position because it's a little more functional than lying down. When you roll forward, see and feel how you have an arch in your back. And when you roll backward, feel how that rounds your low back out. And lastly, before we move on to the next exercise, let's tie it to function. When you find yourself working in a laptop or on a computer, instead of trying to think about correcting good posture by just straightening your back, why don't you instead start thinking about rolling your pelvis? There are so many more muscles that connect around that pelvic complex versus your back. You may not be able to hold it for an infinite amount of time, but at least you'll last a little bit longer. So big takeaway with this exercise is move the pelvis because it controls spine, but understand that that's how you should be moving to correct yourself into good posture and hopefully hold it for at least a little bit longer throughout the day. And that's really how you're gonna get to a pain-free back at the end of the day, all right? Commonly, when a low back is painful, the #1 underlying reason, which likely applies to you, is that through everyday life, when you're bending, lifting, moving kids around, picking something up from the floor, you're moving too much throughout your low back. Instead, it's time to help you get in tune with your hips. Watch me as I demonstrate. This is called a hip hinge, which means moving lots through your hips and little through your back. Imagine myself standing or kneeling. If I'm gonna come down and reach for something, let me show you a better angle. I'm not gonna use my back to pick something up. I'm instead gonna try to do my best to tighten up my core to stabilize my back in a good position, and I'm gonna bend through my hip instead. I'm still getting the job done, bringing my body down to pick up whatever I need, but now I'm not moving through my sensitive low back, I'm moving through my hips before, and that's what your hips are made for, okay? Come back up with me. Start in this nice, tall, kneeling position. Butt comes back, so you're starting to sit towards your heels. Chest stays nice and proud. Low back stays nice and straight. Neck is in line with everything else in my spine. And I come up.